How do I know when we're ready? Okay. One, two, three, four, five. Hi, everyone. Dr. Adriana Popescu here with you today on our Firebird Live with the topic, can you ever really heal from trauma? And I am particularly passionate about this topic because I have in the last year started this really amazing trauma treatment program called Firebird Healing, where we really specialize in treating trauma. And of course, we do believe that we can heal from trauma and that we, in fact, can be like a phoenix bird, the mythical phoenix bird that rises from the ashes of ruin, of trauma, of despair. And so we believe that you can triumph over trauma. So I'm going to talk a little bit about that today. So a lot of people think that when you've had really horrible experiences, something you would consider traumatic, that you never get over it. In fact, I remember when my mother passed away a few years ago, someone made the comment to me, "You never get over the loss of your mother." And it just didn't ring true for me. Not that I didn't love my mother, I adored her, but I also knew from having actually lost my father when I was young, when I was in my teens, that for many years it did hurt. And then eventually it didn't. So let's talk a little bit about what determines whether or not even someone experiences something as traumatic. And there's a term here I want to bring up called resilience. Resilience is our natural ability to bounce back from things that we might perceive to be challenging. There are many people who would experience a certain event that some of us might call traumatic because it overwhelms our ability to cope, but they might be able to cope with it just fine and move forward and not really have any lingering effects of that experience. The person who experiences something frightening, horrific, overwhelming, who really in the moment lacks the ability to process and respond to what's happening. Essentially, there's a bunch of biochemical stuff happening in your brain because your brain goes into that fight, flight, freeze response. And a lot of people kind of get stuck in that. Then those folks are likely to have trauma after effects. And that can be a whole range of things. It really kind of depends on if you have had a single traumatic experience. This my little assistant has arrived here, Wookie. What does he know? He actually experienced trauma prior to me meeting him. He's actually a good example of this. Um, and, you know, when I first met him, when I adopted him, he was rather frightened of men. So I kind of got the impression that maybe something traumatic had happened with him with men. But what, you know, as we spent more time together and as he was around males that were not scary, who maybe, you know, I thought maybe he had been abused or something. When he had the experience of not being abused by a male, he actually now has warmed up to them and is just fine with them. So animals can heal from trauma. People can too. So I was saying some of the trauma after effects. That's things like your nervous system can get dysregulated. What can happen, especially if you've had repetitive, chronic kinds of traumatic experience, if you had, for example, abuse, you know, multiple times in your life, if you grew up in a home that was very chaotic or angry or violent, those kinds of things, repetitive stimulation of your amygdala, which is your emotional response center of your brain, repetitive stimulation of that amygdala will lead to a sensitivity to having that activated in situations that are not actually life or death situations. The reason we go into fight, flight, freeze is because our body is mobilizing to keep us safe. So, we get the amp up, we get the cortisol, the adrenaline, the stress hormones all going. The blood flow goes out of our logical thinking part of our brain, the human part of our brain, the prefrontal cortex. And the blood flow reroutes to our extremities, to our hands and our feet, so that we can run away from a potential threat, like a predator or something, or we can fight it. Okay? That's fight or flight. The freeze response is our most fundamentally basic survival technique, where everything shuts down and we go into, like, your heart rate slows down, your breathing slows down, like everything slows down, so that you can essentially play dead and hope that the threat, the predator, whatever it is, leaves you alone. So we're all biologically wired with this. Now, the person who experiences that event as completely overwhelming their system, who goes into fight, flight, or freeze, and doesn't quite bounce back from it, that person is likely to experience some symptoms that we're talking about here. So they could stay stuck, for example, in that amped up fight or flight state. That means that they're going to be prone to anxiety. They're going to be more reactive, more easily startled. Someone comes up next to you and you are jumping out of your skin. A sense of hypervigilance, where you're, always on guard, looking for danger. And then the freeze response, someone who's stuck in a chronic freeze response might have more depression, shutdown, fatigue, exhaustion, dissociation, when you check out of your body. Those are some symptoms of a chronic freeze response, and some people will alternate between the two. And so many people think that because of that, and if you're somebody who has personally experienced trauma, you may find that, you're not able to just get over it, right? Some people are like, well, it's in the past, just get over it, move on with your life. But you can't when you have these trauma responses, like re-experiencing pieces of that trauma. For example, I had a number of car accidents, and when I would drive past the spot on the freeway long afterwards, up to months afterwards, when I would drive past that spot where the accident occurred, I would get that activation, I would get that stress response. My heart would start racing, even if I wasn't conscious of it. I'm like, ooh, why am I getting all amped up? And then I realized, oh, it's because my body remembers this is where the trauma happened. This was a 5-car accident. It was, pretty scary. And because I had had a history of traumatic car accidents prior to that, before I had all the tools that I do now, it reactivated what I had realized, when I had the second accident, is that it reactivated pieces, memories, because my body had stored the memories and the energy, the fear, the shock, all of that of the original event, the original car accident when I was 9 years old. All of that got reactivated in the car accident when I was in my 30s. So I have this firsthand experience of our body keeps the score. Our body remembers these experiences that have happened, and until we discharge that traumatic energy and all the emotion, the fear, the terror, the anger, whatever it was that came with that experience, we really don't get over it. Again, if you didn't experience it as a trauma, this is not relevant. This is just for the people who experienced that thing as, with a sense of powerlessness and a lack of control and a real potential threat to your life, those types of things. So the re-experiencing of that trauma will tend to naturally occur in the form of flashbacks, when it feels like the thing is happening again, or nightmares, or just intrusive memories, like you're going about your business and then images or sensations come into your awareness about all different, aspects of what that traumatic experience may have been. Certain things will remind you of that experience, like the visual I would have of, driving on the freeway past that spot. It could be a certain sound that reminds you of the event or series of events. It could be somebody's tone of voice. It could be a certain kind of person, a certain body type, a male or female, a tone of voice. And, any of those things can then become triggers, a smell, a certain position your body is in. Any number of different things can become what we call trauma responses. And you basically will, excuse me, re-experience some element of that trauma, and your nervous system will activate as if it is happening in the moment. So the thing is, yes, we can heal our wounds from trauma, but they don't necessarily naturally just heal on their own with the passage of time. You may need to do some work on them. And I'm in the process right now of doing this 4-part workshop through Firebird Healing called From Survival to Thrival. And it's a workshop that I'm realizing is really important and valuable. And this has been kind of my pilot run with it, but I'm definitely going to be offering this again because I see the importance of acknowledging with folks that there are stages of trauma that we go through that in order for us to heal. And first we have to acknowledge it. A lot of us don't even acknowledge that something traumatic has occurred. So a lot of people think trauma has to be kind of what we call the big T traumas, assault, abuse, domestic violence, a natural disaster, war, things like that. And oftentimes what's called the little T trauma, which I've actually started now moving away from, big T, little T trauma. I recently heard someone refer to these things as overt trauma and covert trauma. And I think that that's much more honoring of those little T experiences, because the tendency by calling it little T trauma is to minimize its significance. And some of the things that might fall in this category would be things like the loss of a loved one, the ending of a relationship, losing your pet, losing a job, moving away somewhere, some sort of painful experience that many people will experience as intensely and overwhelmingly as one of those big T traumas, because every individual is different in how they interpret their experience. And really, whether or not you call it a trauma is based not on what it was that happened, but your response to it, as well as the meaning and significance you make of it, because a lot of beliefs come out of traumatic experiences. Things like I'm powerless, I'm helpless, this kind of victim consciousness, like bad things happen to me that I can't control. I am unable to be safe. I'm unable to protect myself. The world is an unsafe, dangerous place. All these kinds of beliefs can come out of having these experiences. And unfortunately, because your point of view is kind of what creates your reality, then you really have to look at, okay, if I believe all these things to be true, am I actually potentially going to recreate that dynamic over and over again? And we see that, we see people, for example, who were abused as children, who may choose in relationship a partner who is abusive, and we'll see the patterns repeating themselves. So we really, when we're talking about healing from trauma, we first have to acknowledge that it occurred, and then we also have to reestablish safety. That is really important. And safety might mean making some changes in terms of who we have in our external world, where we go, where we live, who's in our lives, are they supportive to us or are they abusive to us? Those types of things are going to be really important. And then we also have internal safety, right? That sense that I am safe. And we may need to do some work around that to create that. And some of the things that, we find helpful is, as treatment professionals, is giving people emotional regulation tools. So that's things that basically calm your nervous system down, that calm that fight, flight, freeze response. Because once that gets activated, and it's very automatic for trauma survivors for that to get triggered, your brain essentially has gotten hijacked by those more primitive parts, the reptilian and mammalian brains that are responsible for that fight, flight, freeze response. Your logic and thinking goes out the window. You tend to even forget you have tools that you can use. So this idea of using emotional self-regulation tools, it's like a muscle we have to build. So I usually recommend to my clients, as I teach them these tools, use them for low-level stressors. Use them for getting annoyed with your kid, getting stuck in traffic, feeling nervous about an interview, like things like that, lower level stressors, before you try to, apply it to a full blown panic attack, fight, flight, freeze kind of moment. Because as you get more confident and build your ability to manage stressors like that at lower levels, you increase the odds that you're going to use those tools at the higher level stressors, because they do work. These tools that we teach, these emotional self-regulation tools, and there's so many of them, but some of the ones I like to use are things like breathing techniques, like a box breath or a 4-7-8 breath, different things that will calm the nervous system through the vagus nerve. So they're polyvagal exercises. We also have tapping, EFT. There is from DBT, dialectical behavioral therapy. There's TIP, which is temperature and pressure and different, I forget what the acronym stands for, but it's things like immersing your face in cold water or splashing cold water on your face, holding ice cubes. That temperature shift will also activate the vagus nerve and help you get out of that sympathetic nervous system arousal into a more parasympathetic relaxation response. Exercise can do that. Progressively tightening and relaxing your muscles. So like tensing up all your muscles, breathing through that, and then letting the muscles release. And you can do that for muscle groups. Like I'm going to do that with my fists and my arms, and then I'm going to do that with my legs, and I'm going to do that with my gut, and all those things. You can do specific muscle groups, or you can kind of do them all at once, or different, whatever feels right for you. So there's a lot of nervous system calming techniques that we first want to use to reestablish a sense of safety, to get the body out of thinking we're in a life or death, panicked situation, and start to calm things down. Then we can also use some of those tools like EFT or other trauma processing modalities. This is where we now get to the stage in the healing process of trauma processing. We have to do the work on the events themselves. So releasing the trauma that's been locked in the body, releasing the emotions that got stuck along with it, challenging the beliefs, what I would call the core false beliefs that came out of trauma, and reestablishing a sense of self-efficacy. I can protect myself. I can be safe in the world. I can be happy, have a good life, all those things. And really then starting to look at, healing the relationship with self, healing relationships with other people, because it may have become difficult to trust people as a result of your trauma, whatever it may be. But the processing really has to occur first. So things like EMDR, brain spotting, somatic experiencing, sensory motor processing, TRE, which is very interesting, trauma release exercises, trauma sensitive yoga, all of these sort of more body-based, somatic-based, access consciousness has access bars and body processes. And so all of these sort of more somatic, energetic-based modalities can really help to release that tension, that trauma that's been held in the body. When we're doing EFT or TFT, these tapping on acupuncture points, one of the things that seems to be happening with that is the process of memory reconsolidation. So it's essentially extinguishing that trauma response that's associated with the memory. So with my car accident, when I did this work, I had to tap on all the different aspects of the accident, right? The sound of the screeching tires, the impact of, the cars hitting me, the panic and the I can't breathe and oh my God, and all the things I was thinking at the time. And then afterwards I was shaking and crying and all of that. I tapped on all of those aspects of the trauma and eventually, was able to release it. And so that when I would look at the memory of that, it no longer had all that emotional charge. It no longer had that traumatic stress attached to it. And I could, now I can look back on that experience and tell you, yeah, it was crappy, but I'm okay. I survived it. I no longer have that re-experiencing of the event because I've extinguished that, essentially what became a conditioned response. It was hard for me to drive after that. It was definitely hard for me to be a passenger in a car where someone else was driving and I wasn't in control. There were a lot of those like powerless kinds of feelings, helpless, that I had to overcome. And these energy psychology techniques really helped me with that. So that's kind of the overview of the whole process. It's a stages of healing, and we really can't force our way through them. We have to go at the pace. I just interviewed an EFT expert. He's going to be coming out on the podcast probably in about a month or so. And Craig and I talked about how it's so important to go at the client's pace, right? Sometimes it's like micro steps or baby steps, especially for somebody who has had chronic PTSD, repetitive incidences of trauma and abuse and all different things in all different kinds of ways. You can't just like plunge in there and do all this deep trauma processing before there's a sense of safety, before they have those tools to manage their emotions as they come up, to manage nightmares and flashbacks and intrusive memories when they do arise, because that tends to be what occurs. Someone in the chat is asking if they liked the drama and trauma. Well, yeah, so you kind of have to take that with a grain of salt. But the idea, I think, behind that question when it is asked is there something that you get out of creating that kind of, or attracting that kind of drama into your life, which could lead to more trauma? I'm not sure they're really using trauma in the same terms that I'm using it right now, which is a very clinical, mental disorder, like talking about like post-traumatic stress disorder, things like that. I think drama and trauma, because those words rhyme, tend to be put together sort of loosely. And I'm not sure that people are really necessarily referring to what I'm talking about. But if they are, I guess, how I would frame that question is there something inside of me that keeps recreating these dramatic, chaotic, traumatic situations, right? Again, if you were someone who experienced those things early in life, is there a way in which you're unconsciously continuing to manifest that in your life? Are you attracted to people, places, and things that remind you of that trauma? Do you keep putting yourself in risky situations about it? And so I think the question is really more about, is there a reason why you keep repeating a pattern, if there's a pattern there? And then if there is, what is the point of view or the belief that you have about yourself, the world, other people, relationships, whatever it may be, that causes you to recreate that? Are you getting something out of it? Some people do, you probably might know some folks who like to play the victim or play the martyr. That's, maybe that's an identity for you. And maybe some people covertly that's the shadow side of codependency. It's like you say that it's all about everyone else and you're putting other people's needs ahead of your own. But in that, you may also be playing the martyr or the victim. And maybe you use that in some way to manipulate folks. That could be something with it. I don't think we like it. The comment in that is, I don't think we like it, but somehow we get addicted to that. Yes, I would agree. I think there are ways in which we get addicted to, and there's a biochemical thing with that. We can get addicted to chaos because it activates those stress hormones. And there might be a way in which those stress hormones actually feel familiar to us, maybe even feel good to us. Adrenaline, when you got a bunch of adrenaline coursing through your body, that actually can feel pretty good. Athletes will tell you about that, right? Like, if I'm thinking football players, they're in full blown, fight or flight, and they're using that to their advantage because it's helping them perform, at this high amped up level. Their whole body is poised and ready, to take on the threat, which is the opposing, their opposing team. So there are ways in which people have used this to, work for them. So yes, I do think that can happen. I don't know that we consciously, I have seen people be very attached to their suffering. For example, I think of some, it's sort of stereotypical, but many artists, many musicians, a lot of people who've gotten addicted, especially to the substances, they see that as part of their creative process. they may also see their pain and suffering as part of their creative process. I remember working with an artist who was reluctant to do this work because they thought that their pain and suffering inspired them to create works of art that were, really powerful. And so maybe I don't want to give up my pain and suffering, my trauma and drama that I keep, reenacting, because it fuels my livelihood. So there are ways that I think in which it can show up, and I would take the terminology loosely and not get too hung up on the languaging of when that question is being asked. So I hope that that answers that question. If there's not anything else, I think that I've said all that I needed to for today. I hope that if you've made it this long, that you got something out of this talk. Please do share your comments if you found this talk helpful, or if you have questions about anything that I talked about. I'm happy to respond to your comments in the box below. And if you want to find out more about this process of healing from trauma, please do check out my website, firebird-healing.com, because I have on there a lot of resources, a lot of tools. If you sign up for my newsletter, you can get a bunch of videos on some of those emotional self-regulation, nervous system calming techniques. I teach workshops, I do private sessions. I've got other therapists working with me now as well who are really excellent and really well trained in all of these wonderful techniques as well. And I think, trauma has become such a more prominent presence. It has such a more prominent presence in our world today. It's being acknowledged in ways that it never was in the past. And I think that's a really positive thing. And I hope that our work, my work with Firebird, can kind of lead the way and show people, like I started off saying in the beginning, that we can triumph over our trauma. We now have the technology and the scientific understanding to be able to heal from our trauma wounds. If you are somebody who has experienced these things, you do not have to suffer for the rest of your life. Healing is possible and available. It may not be easy, it may not be comfortable, but you can in fact heal from trauma. So thanks for tuning in. See you next time.